One of the main problems with the lower back is the disc problems. A lot of people have these because we sit a lot and gravity is always compressing us downward, and then throw on top of those car accidents, sports injuries, slip and falls. And so what happens with the discs is they start to wear out and they start to get compressed. Most people know this as bulging and herniating discs. Ultimately though, what's causing the bulge or herniation is actually the spine. If the spine compresses downward too much on that disc, and if it does so unevenly, it's going to start eventually causing the disc to bulge or herniate. And so what you have to do is figure out what's causing the problem in the first place. Traditional things like painkillers, muscle relaxers, cortisone shots, epidurals, all those things, they just treat pain. And stretching and ice and heat and yoga and massage and physical therapy, those are all great too. But if the cause of the problem is the disc and there's compression downward on the disc, all of those things are just going to give you temporary relief. They're never going to fix the true root cause of the problem. So you have to be looking at the disc. When you look at the disc here, the whole job of the disc in the first place is to cushion the vertebrae, create a nice large opening for all of these nerves to exit from the spinal cord, and then allow the joints, which are called the facet joints back here, to have good motion and movement. If you take a disc that's already compressed like this, it starts to narrow the hole and start to create irritation or damage on that nerve. Most people know this as pinched nerves. And in addition to that, it doesn't allow the disc to have a lot of cushion, or the spine to have a lot of cushion. And then it doesn't allow good motion or movement of the spine because the disc is already compressed. And so if you just allow that to happen for years and decades, eventually you start to literally wear out the disc, where you start to create this arthritic and degenerative type condition. It's supposed to be more open like this. Oftentimes people end up with more bone spurs and then degenerative discs. And eventually it's basically where it's bone on bone. So don't allow your discs to just wear out and become more and more of a problem, and stop treating the symptoms of the problem, of back pain especially. And especially if you have pain shooting down your leg, you have to make sure that you address the root cause of the issue. So if the disc is the problem, if the spine is compressing down on the problem, the opposite of compression is decompression. So when you take the discs and you pull them apart, what you do is you allow the discs to rehydrate. The process is called fluid imbication. That's just fancy terminology for saying that the discs are going to suck in the surrounding fluid around the spine as long as you take the pressure off. So you have to open up the disc, and typically the way spinal decompression therapy works, like we do here in my office, you basically pump the disc so it pulls and releases, pulls and releases, pulls and releases like that for a period of 10 to 20 minutes. And if you do that multiple times a week for a while, you're going to end up rehydrating the disc and allowing the disc to go back at least towards normal. It may not ever be normal, but it's going to go towards normal, take the pressure off the nerves, allow the spine to move correctly, and allow the muscles to relax. Problem solved.